Anything else you'd like to share about water quality in general?
Absolutely, yeah. So my current research is focused on expanding beyond a single contaminant for water quality exposure. So routinely we monitor and we protect one contaminant and one agent at a time in our drinking water. Our policies are geared towards a single agent, yet we know routinely every single day through breathing and through eating and through drinking our water that we're exposed to multiple contaminants every single day. So from an exposure standpoint, a point of use device can have multiple benefits beyond reducing a single agent. They can also provide multiple protections to multiple contaminants that could be potentially present, as well as protecting the entire household. So that would actually expand the benefits of our point of use device cost-benefit analysis that we used. And additionally, from a health standpoint, these mixtures exposure, we don't know what their true effects are on human health. So future research, management, and policy should be oriented to looking at these mixtures and then setting policy specifically to the health associated outcomes with these mixtures.
Yeah, and within some of these mixtures are contaminants that we don't have regulatory guidelines in terms of their control or mitigation strategies. These are emerging contaminants like chromium-6 and PFAS contaminants that we just don't really know what the health effects are. So is that part of what you're talking about when you're talking about these mixed contaminants, the emerging kind of unknown health outcomes and also the ones that we do know of?
That question is very tricky, and that's the emphasis of water quality safety in our modern era. We can regulate and we can manage one contaminant at a time quite easily. It's when we start to look at the 5,000 PFAS chemicals that might be present in our drinking water every day or in the environments that we're exposed to. So moving forward, I know there are a lot of regulatory agencies who are focused on looking at some of the mixtures. They're often focused, though, on a chemical standpoint or a mixture of a similar chemical. The research that I want to take, that we're going after right now, is actually focused on the interaction of metals or elements or chemicals and how that may enhance or multiply the health effects when associated with a bacterial infection as well. So we are looking at H. pylori in conjunction with iron and arsenic and other metals and how that's actually leading to increased infection of H. pylori, ultimately leading to exacerbated gastric cancer rates in specific communities who are exposed to certain contaminants in the mixture's form.